Hello, my name is Gwendolyn Kukel, and today I'll be presenting my community analysis on Black women in the United States as my vulnerable population. I chose this population for my analysis because I feel like Black women frequently remain unrecognized in discussions surrounding racism and sexism. And what this means is that women often carry a compounded burden of inequities, facing barriers not only because of their race or gender, but because of how these factors intersect and intensify one another in daily life. So, to help organize this information in a clear and understanding way, I've created this presentation not only to share my analysis, but also to provide visual support that makes the key themes and data easier to follow. This presentation will follow the macro practice framework from our texts, looking at the dimensions of the community, their assets and challenges, the power struggles and structures, social problems, and potential strategies for advocacy. Black women represent a powerful and resilient group of people, and yet they face systemic oppression that intersects across race, gender, class, and other identities to this day. Through this analysis, I will highlight both the challenges and the strengths of this community and how social work can play a role in advancing equity. So, when we define the community of Black women in the United States, it is important to look at multiple dimensions. Black women are not a homogenous group, but a diverse one that includes African American women, Afro Latino women, Caribbean women, and those of mixed heritage who identify as Black. Their community functions not only as a cultural group, but also as a powerful source of resiliency and advocacy and collective identity. Churches, civic organizations, and family networks often serve as a strong community anchor. And intersectionality also shapes this community's dimensions as Black women experience overlapping oppressions of race, gender, and class that I had spoke about that create a unique challenge and challenge with their identity. So, looking beyond demographics, it's important to recognize the functions this community serves. Black women contribute significantly to the social, cultural, and economic fabric of the United States. They are often at the center of family life and caregiving. They sustain faith-based institutions that provide both spiritual and material support and drive social movements and advocacy for racial and gender justice. In the workforce, Black women are vital contributors across healthcare, education, business, and public service, even while facing persistent inequalities. Culturally, they preserve and expand traditions of resilience, creativity, and leadership that shape America's identity. These functions demonstrate how the community not only survives in the face of systemic oppression, but actively creates networks of support, leadership, and innovation that benefit society as a whole. So, according to the blackdemographics.com, as of 2023, there are about 21.1 million Black women living in the United States, which accounts for over half of the Black population. The median age of Black women is 37.6 years, slightly younger than the median age of women in the US overall. And geographically, large populations of Black women are concentrated in the South, in states like Georgia, Alabama, and Mississippi, but also in major urban centers like New York City, Atlanta, Chicago, and Los Angeles. Culturally, this community has deep roots tied to African American history, spirituality, activism, and the arts. These cultural elements continue to shape identity and provide a foundation for resilience and community organizing. Despite their resilience, Black women face significant challenges. Economically, according to the U.S. Census Bureau of 2020, Black women working full-time year-round earned 63 cents for every dollar earned by a white non-Hispanic man, which translates to about 500 or $5,500 less annually than the national average for women. This wage gap contributes to higher poverty rates within the U.S. Department of Labor, and reports that nearly 21% of Black women live in poverty compared to 13% of white women. In terms of health, disparities remain especially concerning. The Centers for Disease Control and Prevention reports that Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women and are disproportionately, that's a hard word, impacted by conditions such as heart disease, diabetes, and breast cancer. The criminal justice system also affects this community disproportionately. According to the Sentencing Project of 2020, Black women were imprisoned at a rate of 1.7 times higher than white women, often tied to systemic inequalities in policing and sentencing. There are even more challenges that Black women face that are well documented throughout national data. For example, these needs reflect both systemic discrimination and inequitable access to resources, underscoring why social workers must focus on this community with intentionality and advocacy. Even while facing systemic barriers, Black women demonstrate extraordinary strengths and assets. In my community, resilience and cultural strength are central values. Black women often rely on mutual care networks, community-led doulas and midwives, and ancestral practices that strengthen and flourish even amidst systemic barriers. Historically and today, they have been at the forefront of leadership and activism. Leaders like Stacey Abrams, Congresswoman Ayanna Pressley and Congresswoman Cori Bush represent the power of Black women in shaping politics and policy. In arts and media, figures like Beyonce, Ava DuVernay, and Shonda Rhimes use their platforms to highlight issues affecting Black women. And community institutions like churches and nonprofits and grassroots movements provide essential support and advocacy. Most importantly, the community values resilience, cultural pride, and collective identity, which serves as sources of empowerment and healing. So, Black women's well-being is supported and shaped by both formal leaders and policy initiatives at the federal and state levels. In Congress, Representatives Alma Adams and Lauren Underwood co-chair the Black Maternal Health Caucus, which has been central in advocating for the Momnibus Act, a package of bill designed to improve maternal health outcomes and address social determinants of health and increase workforce diversity. Several senators are also leading efforts. Senator Kamala Harris sponsored the Maternal Care Act, which funds implicit bias training for providers and pregnancy medical home programs. Senator Elizabeth Warren has proposed linking hospital reimbursements to improved maternal outcomes with the goal of reducing racial disparities. Newly elected leaders such as Senator Angela Also Brooks of Maryland and member of the Congressional Black Caucus are also bringing attention to equity-focused health initiatives. And policy shifts are beginning to make an impact. The Momnibus Act has already been enacted, has seen parts enacted, such as the Protecting Moms Who Served Act, which improves maternal care for veterans. And states have also expanded Medicaid postpartum coverage to 12 months and are increasingly reimbursing doulas, midwives, and community health workers for their services. Innovative state programs like Connecticut's maternal care report cards and Philadelphia's Joy Bank program, which provides financial support and doula services to pregnant residents, are also emerging as models to address systemic inequalities. As you can see, I like a lot of graphics. I think it helps with what we're working with here. The power structure within the Black women's community is shaped by both formal and informal leadership. Formal leaders include elected officials like Ayanna Pressley, as I mentioned, and Cori Bush, who directly influence policy. And the informal leaders often include pastors, grassroots activists, and community elders who guide, support, and mobilize people locally. Policies also deeply impact this community. So, for example, housing redlining created intergenerational wealth gaps. Unequal pay laws perpetuate wage disparities, and restrictions on reproductive health care disproportionately affect Black women. These policies illustrate how systemic forces continue to disadvantage the community while reinforcing structural inequalities. So, I want to dive deeper into the community's formal and informal sources that I was talking about. On this slide, I'm focusing on the structure and capacity of resources within the community of Black women in the United States. So, first, looking at formal resources, we can see organizations and leaders that hold recognized positions of authority, such as the elected officials, policymakers, and established advocacy groups like the NAACP or In Our Own Voice. These leaders work to influence systemic change, particularly through policy reform in areas like reproductive justice and civil rights. Their influence often shapes the laws and institutional practices that directly impact housing, access to healthcare, and economic opportunity. On the other hand, informal resources play a critical role in service delivery and community resilience. These include the churches that I mentioned, elders, grassroots, and community resilience, and mutual aid networks. They often step in where formal systems fall short. So they could provide food, childcare, housing support, and emotional or spiritual care. Informal leaders may not hold official titles, but they command trust and exert significant influence in the daily lives of community members. To truly understand a community, we must listen to its members. When we talk about community perspectives, it is important to center at the lived experiences of Black women themselves. The city and county where I live has a very low population of Black women, and when interviewed, I posed the following questions. What challenges do you see? What strengths do you notice? What needs more attention? And these essential guiding questions are great for social workers, researchers, and community advocates. And so, one of the most urgent challenges here is healthcare discrimination, and this is true everywhere, not just my own community. Research continuously shows that Black women's pain or symptoms are often minimized by providers, leading to misdiagnoses or delays in treatment. In maternal health, especially, this is particularly dangerous. Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. And employment inequities are another significant barrier here. Limited access to stable, well-paying jobs, which also affects healthcare access and housing stability and overall family well-being. Without structural changes, cycles of poverty and limited access to care can persist. So some of the strengths they identified, though, were this resilience and unity, and these were profound strengths. Many communities draw power from cultural identity, mutual support networks, and advocacy. And Black women have historically been at the forefront of social justice and health equity movements, which is a strength we should both recognize and amplify. Some of the needs that we identified, I think what clearly needs more attention is systemic reform in healthcare. We can address provider biases, ensuring equitable access, and listen to Black women's voices in shaping, healthcare policies, which is critical. The maternal mortality crisis cannot be solved without structural change. Employment equity also requires intentional policy changes, such as fair hiring practices, workforce development programs, and addressing, workforce discrimination. So let's frame the problem by looking at our knowledge base. So, Black women face significantly higher rates of chronic illnesses, including hypertension, diabetes, and maternal morbidity, while also experiencing lower access to quality health care compared to the white women. Structural racism is a key explanatory framework. Social work and public health research point to discriminatory policies, implicit biases in healthcare, and unequal economic opportunities as major contributors to these disparities. To frame this problem, I draw on Kimberly Crenshaw's framework of intersectionality. Intersectionality shows us how overlapping systems of oppression like racism, sexism, and classism combine to create unique disadvantages for the Black woman. My working hypothesis is that issues such as the maternal mortality crisis among Black women is not a matter of individual health, but a structural issue. It results from systemic racism, inequitable healthcare, and bias within the medical system itself. By framing it this way, we recognize that solutions require systemic change, not just individual intervention. This is not solely a matter of individual health behaviors or personal choices, like I said, it is a structural and systemic issue. The persistence of racialized health disparities indicates that the problem lies within the institutional racism, healthcare provider bias, and unequitable economic opportunities. By framing it this way, we move beyond fixing the individuals to transforming oppressive systems. Like I mentioned, the working hypothesis is if social work practice and policy advocacy intentionally center the voices of Black women while addressing provider bias and structural racism in healthcare and employment systems, then health disparities can be reduced. Resilience can be amplified and more equitable outcomes achieved. Sounds simple, right? But as a future social worker, I know that strategies for change must be multi-layered. So on the policy side, advocating for maternal health equity legislation, I think is critical. Partnerships with organizations like In Our Own Voice and the Black Mamas Matter Alliance strengthen advocacy efforts by centering the voices of Black women. On the practice side, social workers must commit to culturally responsive and trauma-informed care, ensuring that Black women are affirmed, respected, and empowered in service settings. Combining policy advocacy with direct community engagement provides the best chance for sustainable change. So I want to give some special thanks to the Black women in my community who helped me out with this presentation. I haven't been in this area for very long, so I do not know a lot of Black women. Most of the Black women I have met through my work at a inpatient treatment facility. So all the women I have spoke with were clients or former clients of that agency, and so due to privacy concern, I am unable to provide names or faces. However, I am grateful for the time I spent with them, getting to know who they are as Black women in the United States overall and within my community. And the references are listed here. I just want to give credit as I spoke throughout this presentation. I want to thank you so much for listening and have a great day.